I'm Dr. Lucietto. I am so sorry. I had a little bit of a battle with Borrelia burgdorferi over here, and I had to get him out of the way. He was kind of hanging in my face. We will talk about Borrelia burgdorferi down the road. What I did want to talk to you about is high blood pressure, all right? I've had a number of patients that have come in, and there's been a variety of reasons why their blood pressure has been elevated, and they don't quite understand when I would treat them and why I wouldn't. So it kind of depends, like our decision and how we treat a patient is variable. It depends on how compliant the patient is, how often we see the patient, and how likely is that patient to come back. If a patient is follow-up risk in our business, we have a tendency to kind of throw the book at them. We give them everything possible and we pray that they will be compliant, all right? Because sometimes it's out of our hands. Once you walk out that door, we can't really have much of an influence. The only thing we can hope and pray is that you will come back for follow-up so that we can continue to educate you to help you take better care of yourself. Now, the hypertension guidelines have changed over the years. When I was in training, they were quite different than what they are now. But the one thing that is very true is hypertension needs to be managed well, and your blood pressure needs to be in a certain range in order to decrease your risk of stroke, heart attack, kidney failure, blindness. When an individual has hypertension or elevated blood pressure that goes unchecked, these are the risks. And unfortunately, hypertension is a lot more common than it used to be. Or perhaps it is better monitored than it used to be. You never know. There's no way of looking into your little crystal ball and knowing for sure why we're getting better at checking it. Now, in my office, when you come in, I will usually get a set of vitals on you, even if you're just there for a blood draw, because we're trying to build our data bank on you. That's how important you are. We want to be able to see what is your trend, because some people have a tendency to ride high and others tend to ride low. Now, teenagers, they're usually low unless they are overweight, all right? If a teenager or pediatric patient has an elevation in blood pressure that is concerning, there's usually a secondary cause. There's usually something else that needs to be found and addressed, and then the blood pressure will return to normal. So we're not so quick to jump on using medication, but we won't talk about pediatric patients until I get somebody who really wants me to, all right? For adult patients, which are patients who are 18 and over, although it is a gray zone between 18 and 21, but we won't get into that. I'm sorry. I promised you guys I would not get too technical. When I finally get to the point of being comfortable enough to actually do a few lectures for medical students, then I will get technical. All right. I promised you I was going to make it uncomplicated. Now, blood pressure usually is determined through a measurement on your arm, your upper arm, all right? A cuff is put on there, and most places have an automated blood pressure cuff that will help reduce the likelihood of us getting very tired hands and carpal tunnel syndrome, because you wouldn't believe how many people we have to measure in a day. So we use the automated machines. They're not necessarily more accurate. If we have a question about a measurement, we will do a manual blood pressure in order to double check it. We'll also try moving an individual's arm to a more neutral position so that the arm is at the same level of the heart. That gives you a better chance of having a more accurate measurement. Now, the upper number of a blood pressure measurement is the estimate of the pressure within the left ventricle, which is the workhorse of the heart, when it beats, when the muscle contracts, okay? The lower number is the diastolic pressure, and that is the estimated pressure within the left ventricle when the heart is at rest, All right. Now that is probably an oversimplification, but it's a good start. That's where we always want to start. Good start. All right. We have a goal for that blood pressure on average, because it will change moment to moment. It will change according to position. All right. The best way to measure the blood pressure is when a person is calm, their feet are on the ground, legs are not crossed, and they're in a sitting position. Now, how many times when you go to the doctor's office, you come in, you maybe sit down for a moment, you're rushed into the room, the cuff is slapped on you, you're asked many questions, asked to sign in, double checked on several questions, and then the button is hit and the blood pressure cuff starts to inflate. Now, 5 minutes before, you could have been in the car and somebody could have cut you off. Blood pressure doesn't normalize that fast, but it does come down. All right. There's also the possibility that if you happen to be sick, or if you're coming in for other reasons, like you have a sinus congestion and you need to have that addressed, or you have a terrible flare of your allergies, or you have pain, your blood pressure is going to be elevated, especially if you have pain. Boy, oh boy. Well, I don't think any of us doesn't know what it's like to be in pain, but that will raise your pressure. The goal, pretty much, as a general rule, is to have a blood pressure of 120/80 or less, all right? And that is measured in millimeters of mercury. Now, if you want to split hairs and really work on trying to get blood pressure to be accurate, we would have to take a wire and kind of thread it into your artery and then go into your heart and measure the pressure there. Since that is an invasive way of checking your pressure, we prefer to do it a little more remotely, and that's why we choose to do the cuff on the arm. Now, there's also the wrist cuff where you can put it on your wrist, all right? If you do use a wrist cuff at home, you want to make sure your arm is at rest, your elbow is on the table, and your fingers are outstretched with your hand straight. So you kind of want your arm at a 40-degree angle. Not quite showing that very well, but you want your arm at a 40-degree angle, and you want the hand to be open and the fingers to be outstretched. The reason for that is if you have your hand curled up or your wrist is bent, the position of the tendons and ligaments will actually influence the accuracy of the measurement of that blood pressure. Now, when an individual checks their blood pressure at home, we like to compare it to numbers that we get in the office. All right. It's not that we don't believe you when you come in and you have a blood pressure of, say, 140/80, and at home you're saying, oh, I'm always 110/60. That's great. But when you're at home, you probably haven't gone out in the car and gotten cut off. You probably haven't been running late and had a train stop you. You probably haven't had an argument with anyone, like the front desk lady. You probably have not been stimulated in a negative manner. I don't know a person alive who doesn't have an elevation in their pressure when they've been stimulated in a negative manner. Now, certain things will help lower your blood pressure, like being calm, laughing. Sometimes, I don't want to say eating will help, but we have a tendency to relax when we eat. We have a tendency to relax when we consume fluids. That will probably make a bit of a difference, maybe by about 10-20%. But for the most part, we're looking for a general range and a general trend. When we tell you your blood pressure is elevated when you're in the office, it's not an affront to you, all right? We are trying to help you keep your heart safe, your lungs safe, your brain safe, your kidney safe, your eyes safe. Because if you have uncontrolled hypertension, the only thing it's doing is causing end organ damage to your kidneys, damage to your heart, damage to all your vital organs, and we want to avoid that. Now, there's very few symptoms to having an elevation or a persistent elevation in blood pressure. All right. A persistent elevation in blood pressure is what we're trying to root out and do something about, because we want you to stay healthy. We're not trying to label you or push pills or anything like that. Believe me, we got more than enough work to do. That's something a lot of people don't understand. 120/80 is kind of our goal, all right? Now, certain situations, there are people who would actually get like lightheaded and not do well with a blood pressure of that level. Some of them are older, all right? If somebody has got a problem, say, with an aortic valve, all right, when the heart beats, it needs to have a higher pressure in order to push the blood out of the heart and get past the aortic valve. You'll see a higher pressure in a lot of elderly people who maybe have a little stiffer valve, or they have some calcification at the base of the valve. These are all things that are normal in the elderly. They are not normal in a 20-year-old. I can tell you that, all right? So we take into account the age of the patient, the situation of the patient, the fact whether or not the patient is all agitated, if they've come in and they've had a conflict with somebody, if they had a rough day at work. So this is where the follow-up comes into play. If we see you on one day and you're pissed, well, we know your blood pressure is going to be that day. But if you come in another day and you're not angry, it happens to be your day off, you haven't encountered anybody at work that you just want to, not deal with, and your blood pressure is still elevated, then we got something to kind of keep our eye on, all right? Because that's not a normal physiologic response to stress. Now, when a person's blood pressure, when the systolic, the upper number, is greater than 130 and it's persistently greater than 130, then we start thinking about, stage 1 hypertension, all right? Now, whether or not it qualifies to requiring medical management, which would be the start of medication, that is very dependent on your individual situation. If you're working on reducing your weight, maybe we're just going to watch it. If you're working on managing your blood sugar, maybe we're just going to watch it over a short period of time. We're not going to watch it for like 5 years, wait for you to have a heart attack, and then say, time for you to start some blood pressure medicine. I don't think so. At least that's not my style. So stage 2 hypertension is basically your upper number, or the systolic blood pressure, is greater than 140. If that is greater than 140, then we start thinking about medication. Now, personally, my threshold, like, for example, if you come in and you have your blood pressure checked and it's 160/100, well, you're going out that door with a prescription transmitted to the pharmacy, I can tell you that. There are a host of medications that can be used, but if your blood pressure is that high and you're sitting in my office, something's going on. Now, we can always bring the blood pressure under better control or better management with medication, but then we can see what else we can work on. Weight reduction, perhaps reducing cholesterol, reducing sodium intake. All those things are going to influence your blood pressure. Now, just because we start a medication doesn't mean you stay on it for life. The only thing is that the odds are, when it comes to lifestyle changes, I've seen some people successfully do it, but changing your lifestyle is the hardest thing, particularly since your lifestyle choices are often factored into your living situation. If you happen to feel ill and you end up in the emergency room or at urgent care, all right, and your blood pressure is like 200/100, chances are you're going to be admitted, all right? You might be sent home with a prescription, and that could be that whoever is evaluating you and treating you finds that you are not a risk for being lost to follow-up. But it's all up to you. I mean, if you want to die from a stroke, you want to die from a heart attack, You don't have to take the medicine. You want to go blind? You want to have kidney failure? You don't have to take the medicine. But we're doing it not for ourselves, not for the pharmacist, not for the pharmacy, and definitely not for the pharmaceutical company. We're doing it for you because we've studied these things and we have found that if you manage the blood pressure and you bring it into a good range, chances are you're not going to lose your vision. Chances are you're not going to have kidney failure. Chances are you're not going to have a heart attack. Now, usually those things will happen over the next 10 years. And I will admit I've had those choice patients, God bless them, who have said, I feel fine. There's nothing wrong with me. When I was younger, I used to get bent out of shape about that. Oh my gosh, I used to get so frustrated because I'm like, I know, but what's going to happen to you in 10 years? Well, now, because I need to be worried about my own blood pressure, now I kind of have the attitude, fine, I gave you the prescription. I explained to you why you need to actively manage your blood pressure. If you choose not to do so and you go blind, you drop dead from a heart attack, you have kidney failure, my heart's fine. My eyes, fortunately, are working, and I hope they stay that way. My kidneys are good. That's what happens after 30 years. But it doesn't mean that we don't care. It just means that we've gotten wise enough not to bang our head up against the wall. We want to help the people who want help. If you don't want help, you don't have to come back. Simple as that. But I would prefer that people come back and I can help them, because I didn't go through all this for nothing. So, anyways, if your systolic blood pressure exceeds 180, then you're considered to be kind of in either a hypertensive emergency, hypertensive crisis. This is a big deal, all right? Because at that point, you could be having a problem with your heart right now. Now, it could be that maybe you had a silent heart attack. Silent heart attacks will cause the blood pressure to go up because your heart is going to work harder in order to try to perfuse or get the blood to go through the muscle in order to keep it alive. But those excessive pressures are not doing anybody any good, all right? Especially the person who has that elevation in their pressure. Now, it used to be that the recommendation was like 140/90. That has shifted. Now it's the elderly that are considered to have that kind of blood pressure goal. Part of it is that their tissues become stiffer, and if we drop their pressure too much, they're more likely to have lightheadedness, dizziness, fall, and then we get into the whole please don't break something episode, all right? That'll be something we talk about another day. So our goal is to pretty much try to keep you 120/80, but we don't want to overshoot it and make you lightheaded and make you fall over. So 130/80 is kind of our goal. And we want people to be able to take care of themselves. So we try to empower you too, to try to reduce your stress, reduce your salt intake, maybe reduce your weight. There's a lot of things that you can do. Listen to music in the car so that when somebody cuts you off, you let it go. There's certain things you got to let go. You don't want to die on every hill of conflict, all right? If you do want to address every bit of conflict that comes into your life, you're not going to live very long. And every moment of life is precious. Now, when it comes to medication choices, I would say that would probably be something that I would be more than happy to talk to medical students about, as well as other doctors. I'd love to share some of the stuff that I've learned, some of the literature of why we make the choices that we make, but I promised you I was going to keep it more geared towards patients. If you have any questions about hypertension and your blood pressure, please let me know when you come to the office and we'll try to address it. But these videos are a supplement to kind of help you understand why we need to do what we do. So you have a great day, and hopefully I'll see you soon. Bye.